Are autoimmune gastritis and Hashimoto's thyroiditis really the same condition? Hear me out on this. If you have a runny nose or if you had itchy eyes secondary to allergies, would we say those are two separate conditions, or are those really just allergies? The literature states that between 40 and 60% of Hashimoto's patients may have autoimmune gastritis or signs on their lab tests of that. And vice versa, approximately 40% of autoimmune gastritis patients can also have Hashimoto's thyroiditis. However, there are a number of Hashimoto's patients I've seen who test negative for thyroid antibodies. When we do an ultrasound, they show up as having an abnormal echo texture of their thyroid consistent with Hashimoto's thyroiditis. So is it possible that more than 40 to 60% of autoimmune gastritis patients have Hashimoto's thyroiditis? Question is vice versa. And really what we know is that the immune system is attacking a sodium iodine transport protein with Hashimoto's thyroiditis, and the only other tissue in the body where that sodium iodine transport protein is located is the stomach. And then when we look at it in terms of neurological function, we see that one of the main complaints of Hashimoto's thyroiditis patients, independent of their thyroid hormones, is brain fog and reduced quality of life, secondary to that and depression. Further, we also see that with autoimmune gastritis, we can have abnormal absorption of B vitamins and iron, both of which can dramatically affect the brain and the peripheral nervous system. So I raised the question, are Hashimoto's thyroiditis and autoimmune gastritis really the same condition, just with different end organs being affected and different manifestations in some ways, but a lot of overlap in other ways? Send me your thoughts. Dr. Randall Gates, board-certified chiropractic neurologist, chiropractic physician from Gates Brain Health and Advanced Imaging Reno.